In this week's release of the IHME models for COVID-19, I think it's important to look at 4 different areas in the world that are driving the global epidemic right now. So first and most concerning is the P1-driven surge in Brazil and some neighboring states, such as Peru and Ecuador. In this week's model, we've very substantially revised upwards our forecasts until July 1st. And this in part is due to much more in-depth analysis of what combinations of cross-variant immunity between ancestral variants and P1 and increased transmissibility of P1 can account for what we observed in Amazonas state in December and January. So when we put all that together, we find a much more alarming forecast for Brazil and neighboring countries. The second area of great concern right now is the surge that we're now seeing in South Asia, in Bangladesh, in Pakistan, many states in India. We had been going through a very long period of declining cases and deaths. And now we are in a very rapid expansion in some places. Punjab is an example. Bangladesh is particularly sharp increases. Now, when you look within India at a state like Delhi, where 65% of the population have been infected already, both from a seroprevalence survey and from our own modeling, and now you're seeing this big upsurge starting, it strongly suggests that the epidemic unfolding in South Asia is also related to one of the escape variants. We're just not, because sequencing is not as strong there, we're not 100% sure that there have been reports of, for example, mutations that look like escape variants that are accounting for this transmission. So the third area of concern globally in terms of what's happening is the continued expansion of cases, daily cases in Europe, and now daily deaths going up at a much slower rate, but still going up. And this is happening despite the fact that there's considerable vaccination already underway in Europe, and there is very strong set of social distancing mandates in place. So B117 is driving increased transmission despite a lot of brakes on transmission that we would expect would be protecting them from continued expansion. In our models, despite this very concerning set of trends, we do think that the epidemic in Europe, or the 117-driven epidemic, will peak sometime in late April and start to come down because eventually vaccination, declining seasonality will be enough to overwhelm the increased transmission from 117. And as we have forecasted for a number of weeks, we expect many countries, and we've now seen France do this, put tighter restrictions in place to help in that putting the brakes on 117. Last area of concern is in the United States and Canada, where we're seeing some places, Ontario, Michigan, Minnesota, New Jersey, with increasing case numbers. Some local communities, such as King County in Washington as well, where cases and hospitalizations are going up, and we suspect that deaths will soon follow as well, despite vaccination. And so that is not as dramatic as these other 3 areas of concern. But certainly, given what we've seen in Europe, is of enough of a concern that we should be monitoring this closely. In all of the areas that we're speaking about, the main strategies are still the same, which is wherever you can accelerate vaccination. Of course, that's hard to say for places that don't have access to vaccination, but those that do, delivering the vaccines as quickly as possible. Maintaining mask use is a super important component of the strategy. And then the third strategy is social distancing mandates and strengthening them when things are starting to go in the wrong direction.